Hello, welcome to the Health Hour. Today, we're so excited that you've joined. So please let us know where you're joining from. I'm very excited to announce that today we're live in Peckham at the Inspire African Health Fair. So if you're around that area, please do pop in. We're also live at the Community Hub in Gorton. So if you're around that area, please do pop in. I'm extremely delighted to have with us the doctor who is going to be giving us a fantastic talk on stroke prevention and recovery, which is something that's so necessary for our community. We've got with us Dr. Oge Ilozue. She is a GP partner and trainer based in North London. She has been working with the NHSC in the London region as a senior clinical advisor with the vaccination program for the past 3 years. So she's also chair of her local medical committee, which advocates for frontline GPs, and is the current welfare secretary with MANSAG, a medical association of Nigerians in the UK. She's also a very passionate supporter of all things Black health and Black equity. I am delighted to welcome Dr. Oge Ilozue.
Good morning, everyone. Thank you so much for having me back on Health Hour, which is just the most amazing initiative. Nice and sunny here in London, and I'm really looking forward to joining that health fair later on in Peckham, later on this afternoon. So I've been asked to talk about stroke prevention and recovery, and really, to me, focusing on some of the prevention, and I think some of the issues that make it more common in our communities. So let me just get my slides up. Give me a moment. Can you see those?
Yes,
can you hear
yes,
me
we
and
can.
see those okay? Yeah, great, because I can't see anyone else. So welcome on this beautiful Saturday morning. So, a holistic guide to stroke prevention and recovery. And whenever we say or hear holistic, we mean overall. So, physical as well as mental health, emotions, spiritual. And we're very good at a community at trying to encompass all of those. But maybe some areas we try to neglect. So, I want to highlight some of them in this talk today. So, a little bit about what is a stroke. We hear the term, it's a common word, but ultimately, I want to drill home that stroke is a life threatening condition. It affects the brain and causes the blood supply to be cut off to a part of our brain. And strokes can be caused by a clot or by a bleed. Most strokes are caused by a clot called ischemic clot. And then the other 15% or so can be caused when a vessel bursts and causes a bleed. And it affects a part of a brain and affects the functionality of that part of that brain. It is a medical emergency. So if you're suspecting a stroke and you're in the UK, call 999 and please call the emergency services in the country you're in. So I hope you're all familiar with this popular NHS diagram. It has different formats, but it basically uses this acronym FAST. So F is for face. Has the face fallen to one side? Can they smile? Arms. Can they raise both their arms and keep them there? Is there any numbness or change in sensation on one side? Speech. Is speech slurred or can they not get their words out properly? And T is for time. So you need to act fast. There was a popular term for this called brain attack, in the same way we know about heart attacks. And time is of the essence. There is good treatment, something called a thrombectomy, where they can bust the clot, but you need to get them to A&E and to a healthcare facility straight away if you see any of these signs. So remember that FAST acronym. Act fast because time is brain and a lot of functionality can be saved if the right treatment is obtained. Wanted to also highlight mini stroke, or the medical term is a TIA, a transient ischemic attack. And a TIA is when a part of the blood supply to the brain, a part of the brain, is disrupted. But this is on a temporary basis. So it can last a few minutes or all the way up to 24 hours. TIAs still need urgent treatment when you first get the symptoms. So it could be that weakness, it could be the speech problem, could be a visual disturbance. You don't know whether it's going to stay. So you should still be calling 999 and seeking urgent treatment. Sometimes it's a bit more subtle, then it gets better after that a few hours. And you think, oh, it's fine. But you still need to seek medical treatment. It's a warning sign. And as a GP, I'd be referring you to the urgent TIA stroke clinic in the next day or two to get investigations done. So please don't pay attention to your body. It's all about knowing your body, paying attention to when these changes happen and acting on them. So, what are some of the risk factors for stroke? These are common ones that we see as risk factors for lots of conditions. Main one is high blood pressure, hypertension. Another one is having high cholesterol. And of course, there's a genetic factor as well as a dietary factor and a lifestyle factor to this. One that you may be less familiar with, irregular heartbeats. So we're encouraged as GPs, anyone over 50, 65, it's very common for a heart to go into atrial fibrillation, which means the heart isn't beating as effectively as it has done before. And that means clots can form. And then there's a risk these clots go up into the brain and cause a stroke. So we should be feeling pulses when you come in for general checks at our GP or our nursing teams and checking, is the pulse nice and regular? Can't always pick it up in that quick check. So if you feel palpitations or if you were to have an ECG for any reason, it may pick this up. But we should be doing a lot more spot checks because we do know there's a large population out there with AF that we haven't diagnosed. And having diabetes is also a risk factor. Diabetes is a risk factor for all cardiovascular events. So heart events, kidney damage, brain damage, like a stroke. And the other main risk factor, being Black, unfortunately, we are more likely to have a stroke. We're twice as likely as the rest of the population in the UK, and we're more likely to have it at a younger age. So we associate stroke with an older age issue, but we can see it at younger age. And I'm talking at less than 40, less than 50. And so we're likely to have it younger, and we're twice as likely. So being Black is a risk factor, unfortunately, and we need to take that seriously. So the reasons for this are complex and multifaceted. Can be linked to having high blood pressure, and I'd say uncontrolled high blood pressure, blood pressure that's not managed. And we'll talk about that a bit more. Diabetes as well, or sickle cell. But the four reasons, like I said, are not well understood. But we have to take it seriously that being Black is a risk factor for having a stroke. So, what can we do to really try to reduce this risk and prevent it now that the data shows us that? So, the aftermath of a stroke. Sadly, it's a devastating condition. Over half of stroke patients may die as a result of the stroke. The rest can be left with devastating, life changing symptoms that can affect every part of life. So it can affect mobility, can affect speech, cognition, emotions, many other areas. So these are complex needs. And of course, they have a major impact on the individual that's affected with a stroke and also their families and carers around them, and can affect every aspect of life, ability to work, finances, your whole lifestyle. So this is a life-changing condition in many circumstances. Recovery from a stroke is possible. And this depends on the extent of the stroke, so the extent of the area of the brain that's affected, and also how long until treatment was sought as well, because time is brain. More brain can be damaged and affected if you're not seeking medical attention as soon as the stroke happens. So recovery is of a multidisciplinary approach. It needs to involve the whole range of the healthcare professional team. So your doctors and your nurses, especially initially, but rehab is a major feature of that. Physiotherapy, speech therapy, occupational therapy. You have people come in the homes. You may need adaptation to the home. And ultimately, regular reviews and prevention of future stroke strategies. This usually involves medication. And carer needs, this can be really cumbersome on carers. So it's important that we holistically approach that whole picture, the person, carers, and making sure they have the right help around them in terms of any additional support they may need. And I like this picture of the brain that just reminds us of the different functional areas of the brain. And after a stroke, the deficits in function can depend on which artery was affected by that clot or that bleed. So, motor and speech production, voluntary eye movements, speech production. So there's another area that does production, but also comprehension as well. Your motor skills, ability to feel, language comprehension, vision, memory, your balance and your muscle coordination, your hearing. And then the frontal lobe is your higher intellect, self control, inhibition, emotions. So you can see every part of life and our functionality can be affected depending on the area the stroke affects. So, my mother's favorite term, and what I say in each of these talks, and I know Khan's a big proponent, prevention is better than any cure. So, how can we try to prevent it? This diagram shows about some of the 10 modifiable risk factors. So some of those are some of the ones that we can actually change. So blood pressure, as I've already mentioned, medication may be needed. So this idea that we can avoid medication to control blood pressure, we need to really address. Reducing cholesterol, again, medication may be needed depending on your risk. Reviewing your diet. So reducing salt in particular is really crucial, especially when it comes to blood pressure control, and processed foods. I always say we're all supposed to be in our villages, growing our own vegetables, rearing our own cattle. But no, we're here, we're reliant on the major food industry for our food. So we need to be really intentional about what we're putting in our bodies because, the powers that be are not doing enough, the food industry wise. So we do need to really be careful about what we are eating and for the sake of convenience, how we could be damaging our health. And I'm talking to myself as I'm talking to all of you here. Exercising regularly. So the key thing is that we need to move more. We need to get up to that 150 minutes a week. And at least when I would say over 40, strength training and movement, walking, brisk walking is more important than maybe the HIIT high intensity exercises we may have done in our younger days. But it is really important. We're way too sedentary in this lifestyle in the UK in particular. And I'm also talking to myself as I'm talking to all of you. If you're a smoker, stop smoking and reducing stress, reducing stress. And some of the other ones down here are around reducing alcohol or alcohol in moderation and maintaining a healthy weight. I really like this. It's very American, but I thought it was quite a nice, visual, colorful way to look at it and maybe try to address your risk. So, blood pressure, and people know blood pressure, hypertension, but do you know your numbers? I always say. So, if you're diagnosed with hypertension, you should maybe be on medication and you should be checking it on a regular basis. If you're not diagnosed with hypertension, you should be getting checks. If you're over 40, get your NHS health check. A lot of community pharmacists now offer blood pressure checks. Blood pressure machines are a lot more accessible, very cost effective. So maybe have a machine at home and check it from time to time. But this chart talks about low risk being if your blood pressure is 120 over 80 or less. Caution in that middle range, 120 to 139, and the lower number, 80 over 89. And if your blood pressure is persistently 140 over 90 or higher, or you don't know it, you need to be ticking that high risk box. So it's not just about a one-off reading, it's about really knowing what your numbers are. Because your numbers, I know mine runs generally low, but another person may know their runs around the 130 mark. So it's really important to know your numbers. And if it's persistently high, get assessed by your GP. We now do ambulatory blood pressure monitor, where we may give you a monitor or ask you to take it twice a day for a week and then look at the numbers to see what the average from morning and evening over a week is. Cholesterol. So these figures are American. So 200 is about 5 millimoles, which is our units. So we want that cholesterol to be less than 5. If you've had a heart attack or you're diabetic, we want it even less than 4. And we break it down into good cholesterol and bad cholesterol. So again, having that blood test and really analyzing the numbers. Hearing, oh, your blood test is normal is not good enough anymore. You should have your numbers. You have the NHS app. You can look up your test results on that app. So I think us being more informed in this way with actual detail of numbers is really important. And if you're in the middle range or your cholesterol is high, that's high risk and may need medication because there's only so far you can go with diet. So a lot of that is genetic too. If you're diabetic, that's high risk. Some of us are pre-diabetic, so in that middle range, and it's a window of opportunity to really make those lifestyle changes to get us back into the normal range. Even if you are diabetic, it's possible to reverse it. So there's always things you can do to make the situation better and reduce your risk. Smoking, stopping smoking, don't be around smokers. Yeah, don't vape. We need to really stop that because we don't know the harm that may be doing in future. But if you need something to try to get you to stop smoking cigarettes, that may be a stopgap, but you shouldn't continue vaping indefinitely. Weight management, we all know we need to be careful, especially that middle spread that happens as we get a little bit older. Physical activity, and then awareness of history of strokes in your family. So finding out, asking relatives about that. And the age one, we know it can happen in younger age. So be aware of that, especially if you have risk factors in all the other areas. So I wanted to talk about stress and spend some time on this because I think in terms of prevention, this is really crucial. Stress, I mean, everyone, you can't avoid stress. And actually, sometimes it's a way to make us stronger and more resilient. But we need to really be aware of the impact that this has happened on our physical health in all areas. So we know that stress has an impact on mind and there's a connection to our physical health. Stress, depression, adverse life events can weaken our immune systems, and this makes our body more susceptible to all illness. So, we really need to be aware of this and address it. Chronic stress has an impact on our physical and mental health. So, how can we manage this? And I think, first of all, we need to acknowledge that it is an issue because sometimes we are really good at putting that mask on. We're really good at saying we just need to get on with it. We're really good at minimizing what we're going through. We're really good at, comparing ourselves to others and thinking, oh, if they can do it, I should be able to. Let me keep going. So we really need to acknowledge it as an issue. We need to be really clear. My trigger may not be your trigger. So you need to spend time to address what is my trigger. Pay attention to your body, your mind. Pay attention to how you react to things. Pay attention to those microaggressions that add to all manner of stress, and really start to think about it, identify them, because once you know what they are, you can maybe start making steps to address them. Moving more and nutrition always helps. Getting out into the fresh air, taking a walk. We're now entering spring, summer months where there's more sunlight. So that always is better. So using that as a way to emotionally center yourself and be better able to deal with some of the issues that and challenges we come across. I am a big fan of therapy and counseling and taking the time to get the right person and also figuring out. And a lot of it, the CBT, which is cognitive behavioral therapy, is about identifying those triggers and then coming up with strategies to address them. So it takes time because what is one person's trigger is not the next person's trigger, but it's really important to take that time and to really seek that help in addressing some of those issues. If you've gone through grief, if you've gone through bereavement, if you've gone through an adverse life effect, these are traumatic things. So take the time. You shouldn't be able to just switch it off like a light switch. It doesn't work that way. So taking time with a professional therapist or counselor to address and then deal with it can be so valuable and can help and will have a positive impact on your physical as well as your mental health. So it's not just about mental health. We're talking about your physical health here too. Things like mindfulness and meditation. So people get worried about yoga, especially if you're from a religious background. But it's about, for me, I will then focus on a scripture or passage that I find really inspiring, and saying that over and over and over, and just silencing your mind a little bit. And it can help get better sleep. And we know better sleep can lead to better health as well as really being able to then free up your mind to have more ability to deal with some of the challenging situations that we're all facing. And I always say those positive social interactions were built for fellowship, were built for community, which is why I love the Khan community so much, and others that I'm involved in, like Mansag and LMC. Positive social interactions, seeking help early from trusted sources. So building your tribe, I also call it. Build those people around you that you can feed into each other, that you know, I pour into you as you pour into me. We edify, we support, we encourage, we hold each other's hands through the challenging situations. We celebrate together, and we can be ourselves, our authentic selves with each other. That unmasking is so important, and having people that you can trust to do that with can really make all the difference. So the other thing I wanted to address, and I think we have to talk to ourselves here, medication adherence. So I was at a conference last week, the Primary Care Cardiovascular Society, and there was a talk on hypertension in the Black population. So there's a doctor based in South London that has a high risk hypertension clinic. So they were doing lots of studies about Black people, blood pressure, what medications work. So the work is going. We do need to get involved in some of those trials as well, because we can't say they're not for us, and then we then get involved in some of the solutions to try to address it. Then another professor had gone out to a clinic in Barbados, and they have polyclinics, and they have a lot of combination medication, and they have a set protocol. So he talked a story about a woman that came in, had very high blood pressure. She was on 4 different tablets for her blood pressure. And they were like saying, and she was like, "Do you take your tablets?" It's like, "Yes, yes, of course I take my tablets." And then the doctor moves on. And actually, we need to be a little cleverer about how we address conversations about adherence and compliance with medication. Because how many times I go on home visits and you'll see the cupboard, all those tablets that are there. And I know patients don't want to tell us they're not taking their medication because they feel like it's letting us down. But it's so important to have those honest, open conversations if you're not taking your medication for any reason. And there's so many, sometimes very viable reasons why. The side effect profile, but there's lots and lots of different blood pressure tablets, so we can try different ones. It could be that you think you don't need medication anymore, so we need an honest conversation about that. What is your blood pressure doing? Are you keeping an eye on it at home? Do you know the number you should be? So blood pressure tablets, we need to make sure it's not just about have been prescribed blood pressure tablets. It's not just about collecting them from the chemist. It's actually about taking them, but also making sure that it is making a difference to that blood pressure and those numbers are coming down. So the story of this woman was she was on 4 tablets. She says, yes, she takes them. Yes, she takes them. But we know that there's something called direct observation therapy. And actually, you need to admit patients to hospital to do this, because it's about giving them the medication and measuring the blood pressure to really say the medication doesn't work. Because the common thing is you come in, you're on 1 tablet, we check your blood pressure is still high. Are you taking your medication? Yes, you are. So we give you another tablet. And then you come back again, your blood pressure is still high. Are you taking your tablets? Okay, so we give you another tablet. And the reality is that patient may not be taking those tablets. So we need to know that so we can address it with the right medication for you. So the direct medication therapy is like if you give the patients the medication, all those 4 tablets that they're on, they may keel over because they're not used to it, because their blood pressure suddenly falls. So I think it's about that honesty. And I always say the consultation, the GP consultation, I see it's a meeting of 2 experts. You're the expert in your life. You're the one in your body every day. I'm the medical expert. So that consultation is a meeting of 2 experts. So I need to make the time, make you feel safe, build the trust so you can open up about the barriers to maybe taking medication, your concerns about side effects, your concerns about even needing medication, and your risk factors. Because the honest conversation is you think that the tablets are a lot at the beginning, but if you were to unfortunately go on and have that stroke or have that adverse effect, the tablets we're giving you are going to be even more. And that's how this diagram kind of demonstrates that. So we want to prevent it. It may be that we need medication to do that, but let's work together to really try to get the control, because we know if you reduce those risk factors, you're significantly reducing your chance of stroke. And that's what we all want. So again, the type of tablets are blood pressure tablets, most common, cholesterol tablets to reduce cholesterol. And if you have AF, which is that irregular heartbeat, there's anticoagulation, and the evidence is clear. It's much better than aspirin in preventing clots and preventing that stroke. So really important you take that and you are compliant with that. So always discuss your side effects. We have lots of options open to try, and be honest and open about if you're able to take your medication and any barriers you may face to be taking your medication. So, in conclusion, because I always enjoyed the discussion at these health hours, prevention is better than cure, as we've said. Stroke is a major health condition that can be prevented. So let's address the risk factors that you can change, called modifiable risk factors. Make sure your blood pressure is controlled. Make sure you know your numbers. Make sure that that medication and those lifestyle changes you're making are actually working, and adapt and tweak as need be to make sure you're getting the goal you need to get to. Address stress, and we all need to address stress. We need to explore mindfulness, counseling, be more aware of our triggers, have those strategies to reduce. Fellowship, church, mosque, communities, all of these things are really important, but we need to show up as our authentic self and be honest with ourselves and trust in others about what's really what challenges we're really facing, and then seek the help to address them and overcome them. I think so. And again, I'm talking to myself. This is my message for myself this year. We need to be radically intentional about self care and explore what that looks like for you as a unique individual. So, thank you so much for listening to me, and looking forward to having a discussion about some of the points raised.
Thank you so much, Dr. Oge. That was fantastic. It was incredible. It was educative, it was informative, but it also was holistic and really thought about all the different aspects of stroke prevention and recovery. So I'm really grateful to you for that fantastic talk. So just picking up from what you were saying, I think there's so many really interesting points that we can delve deeper in. And we would love for people to send in questions regarding this talk that you may have. So we've had a few questions come in. And the first question someone has asked is, are we genetically more prone to stroke? And if so, why? I think that's really an important question to understand what our predisposition as Black people is to stroke.
I really think so. Yeah. No, I think it's a great question. And it's not one that we know for sure. We know that we are more likely to have high blood pressure and have that diagnosed earlier. And blood pressure is a really major risk factor in strokes. So is it linked to blood pressure? And what is blood pressure? Is the vessels, getting tighter, and the heart not being able to pump the blood round the body as effectively, or working harder. So there's a genetic component to the vasculature of those arteries and the way our body responds to it. There's genetic control components to salt retention, and the fact that we're salt retainers, which is why reducing salt in our diet is so important. So, and risk factors in terms of what our parents or relatives may have gone through. So there's a genetic aspect of why we're higher risk, but I think it is more complex than that, more multifaceted than that, and research is ongoing. I think stress, and that there's some talk about the genetic trauma that we carry, from things that have happened in the past, some of the unfair discrimination we faced, our ancestors have faced in the diaspora, in the Caribbean, in the Americas, as well as back in Africa. So there's something about trauma and carrying that in your genes, and that then affecting how you approach lifestyle and disease. I think I always say we're all, like I said, really allergic to London. We can't cope. Our bodies don't cope with the processed foods as well, maybe as others. I don't know. But there's something about really trying to get back to that whole food, eating the rainbow, and really cutting down on the processed, mass produced foods that we are. It's so much easier and more convenient with our busy lives to get. So I think, like I said, multifaceted, but genes have a part to play, and but in more ways than maybe we know and fully realize. But we know the risks, so it's then trying to address them, as well as doing things to try to prevent that genetic stuff from happening in the first place. So there's even stuff about being, you are our grandmother held us, so that our grandmother's nutrition affects us today, so there's something about really understanding that so we can live wholer, fuller lives for us and the next generations as well.
Thank you so much. And I loved what you were talking about epigenetics and
Great.
how we understand very, very little knowledge about this, but we're starting to understand that the stress and the environment in which our genes exist. So we might have that genetic predisposition, as you say, to high blood pressure. And we know that Black people have a much higher risk. And we talked about the salt retention and how we process salt differently. But that epigenetics, the environment in which those genes function, and
Yeah,
that's something that can be passed down from generation to generation, including the trauma. That's stuff that we're just learning about. And we know that that can impact our risk of not just high blood pressure, but other things like autoimmune conditions that we know that Black people are more likely to get. So it's really, really, I mean, when we say stress management, we're
mm-hmm.
not talking about it's not just about you, it's also about your future generations. And
Totally.
we know that we as a people, firstly, life is stressful. Modern life is very, very stressful. But then add in the extra layer of minority stress. So the stress of existing in spaces where sometimes we don't feel as welcome or as
Totally.
celebrated. And it's almost like we need to fight our corner. Sometimes I talk about how I'm really conscious of how I need to present myself so that I'm not thought of, I'm thinking, I don't want them to think of me as an angry Black woman, or think of me
Yeah.
as, all of those things. So how do I come across as assertive without triggering people? It's just like, it's such a minefield living in the Western world where you are a person of color, you're dealing with that additional minority stress. But we know the effect of chronic stress on our sympathetic nervous system. So
Yes.
in
Exactly.
our nerve, we have what we call, so there's the active nervous system, so the nervous system that helps you move your arms, your limbs, and all of that. And then there's the nervous system that we don't control, and it's kind of controlled by functions in our brain. We call it the autonomic nervous system.
Yep.
And so there is the sympathetic, which is the fight and flight part of our nervous system. It's what means that, when we were cavemen and we saw a lion, we ran, right? Or we said we're going to fight the lion.
Yeah.
And then there's the parasympathetic nervous system, which relaxes us. We call it the rest and digest. Now, what happens to a lot of us is that sympathetic nervous system, which releases hormones like adrenaline and cortisol, and we know cortisol is steroid, which has such a negative long-term impact when
Yeah.
it's sustained for prolonged periods. Those things we know impact our increased risk of hypertension. And not
Absolutely.
only just that, it's also inflammatory states in the body that then predispose us to things like strokes that we're talking about. So there are biological responses to chronic stress. And that's why when we activate the parasympathetic system and we relax ourselves, so things like what Dr. Ilozue was talking about, breathing in, mindfulness, spending time in nature, really trying to enjoy ourselves, spending time with family and friends, laughter. These things are restorative. They bring down that they bring us back down from that heightened state of stress, and it really has long-term implications for our health. So yes, there's genetics, but lifestyle and the environment is really, really important. Now, somebody is
Most definitely. I was also going to just add as well, there's also environmental. So how you respond to things, triggers, your children are watching that as well. They're learning from it and then they then duplicate and the cycle continues. So it's really important to spend the time to do that work because it's not necessarily automatic, and really identify what works to bring the restorative. I love that word, what fills you up, what fills your cup up again, truly, that then the next time you may not respond as much because we are heightened, we're waiting for the next disaster to happen. So we're not supposed to be in that fight and flight consistently. You need it to save your life from the big thing, and sometimes you need it to get going and be productive. But if you're running at that level, it does have a major impact on your organs and your health. It's a balance, the yin and the yang, as they say. You need to have that for moments, but then you need to know how to come back, restore, be more at peace, be more at rest. And our children and the next generation are watching our responses to things, and they copy by seeing what you do rather than what you maybe tell them. So that's another reason why it's so important we all do this work as a community.
I love that. Someone has mentioned about undiagnosed neurodiversity as a major source of stress,
Mm,
including fear of disclosing to employers or loved ones. And I think this is really important because we know that we are less likely to be, so especially our young people who may have autism or ADHD, they're less likely to be diagnosed. But also conversely, a lot of our young people are singled out. And that's something that is a challenge for our community. But
absolutely.
understanding the nuance of neurodiversity is really, really important. But actually, I also think that, and I talk about this, the idea that modern life and addiction to this
Yes.
has created syndromes that look like um, ADHD. Now, ADHD is a neurodevelopmental disorder that usually starts in childhood, according to the diagnostic criteria. A lot of the time, it's not picked up. We acknowledge that. But nowadays, so many people who may not even have the classic neurodiversity ADHD from developmental years are developing a kind of syndrome that's very similar in that they're struggling to focus, um, they're struggling to get tasks done, they're struggling with procrastination. And a lot of this is about poor, poor control of exposure to social media, the 24-hour news cycle that goes drip, 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 just getting prompts about things constantly, lack of boundaries with emails, the accessibility 24/7 and not having appropriate boundaries in place and that creates a very high level of stress. So it's really important that we think about that as well.
Most definitely, yeah. So, and again, it's just about identifying that individual, that personalized care, treating that person as an individual, treating yourself as an individual, and not, making it all like one size fits all. So that neurodiverse child or even adult, we know we are identifying it a lot more in adulthood, and then looking back, you realize the challenges you had are because you weren't aware. And all the diagnosis does is make you aware, and then you make the approaches to change. So it is about, again, doing that work, and then no shortcuts to figuring out your own personal triggers, and then radically being intentional about addressing them on a consistent basis.
Um, Thank you so much. That's fantastic. So someone has asked, some people don't normally like taking blood pressure medications. I would like to know whether these medications have an effect on our kidneys. Now, I'm going to hand over to Dr. Oge in a second, but I want to
Mm.
actually let you know that I have high blood pressure. I've been diagnosed since I was 27 and I've been on medication ever since. Now, the thing about it is we know our community, there is a general distrust for good reason to sort of medical establishment, and a lot of people are hesitant about medications. Now with high blood pressure, because it's a silent killer, and a
Mm.
silent disease, a lot of the time you're not feeling the symptoms. And so you feel, why should I be taking medication when there's nothing wrong with me? And of course, all medications have side effects. The medication that I take, which is amlodipine, and I've been taking since I was 27, sometimes, particularly in the summer, I get a bit of ankle swelling, but it usually goes, and I know, okay, I have to walk around a bit more and keep my feet up. There are other medications that, we have to monitor your kidneys whilst you're on it. But these medications are widely safe and have been used for many, many years, and we know that they're effective and they work. And this is why you have to have regular review. You don't just start a medication and you don't check and follow up with your doctor. But it's really important that if your blood pressure is so high and the lifestyle factors have not brought them down, and the doctor is telling you, or the clinician is telling you, that you need medication, to really, really understand that without medication, this is how people get strokes and kidney failure. And it really pains me that our people are dying needlessly from
Yeah.
strokes, from kidney failure, from heart disease, because we are not taking medication. So I'm not advising people to do something that I'm not doing myself. It was not easy. When 27-year-old, you have to take medication
Yeah.
for life. But I have to do it. And if not for that, I may have had a stroke by now. But I'm here, I'm healthy, I'm well, because I'm taking my medication as prescribed by my doctor. So I'm going to hand over to Dr. Oge.
Yeah, no, I think it's a really honest conversation because some of them do cause side effects and also exploring the health beliefs. So a common one, a friend of mine said her father, and this is a friend that's a medic, her father unfortunately had a stroke, and see the blood pressure medication she found in his cupboards, just in drawers, not taken over years. And so his thing was when he felt unwell, he then took the medication then. But that's not how it works. Blood pressure, like Ituni said, is a silent killer. You may feel completely fine until you collapse with that stroke or until your kidneys decides they don't want to work anymore. So it's really important to control and prevent it. And if you're having side effects, so the most common side effects, there was a question, you may feel dizzy, you may feel more tired. Some people get a cough, some people get the ankle swelling. It may cause you gut problems. It may cause a rash. There's a whole list of side effects, and everyone's constitution is different. So it is about exploring your individual side effect profile and what you're experiencing. And the only way to know is to really deliberately try it, stop it, pay attention to your body. Again, like I said, you're in your body every day, so you know yourself. But we don't pay attention. We're rushing around busy and we're not paying attention. So be mindful of paying attention and then coming up with a plan for you. It is that you need, and then also checking what is that blood pressure without the medication and on the medication, and having that risk benefit discussion, because you don't want it to get to a point that you then have that stroke and then we're trying to prevent further strokes and then do other things to try to make you better. The blood pressure is such a huge thing. And the side effect profile is we should be monitoring your kidney function on some of them at least once a year. I think you should be keeping an eye on your blood pressure at home rather than relying on when you get to the doctor once or twice a year. Pharmacists have machines. Like I said, machines are very accessible now. And I think if you have side effects, we have a whole long list of other ones we can try. I think we need to be better at using combination ones because, unfortunately, in the Black population, we have what we call resistant hypertension. Our blood pressure is harder to treat for whatever reason. So there's something about combination to reduce that pill burden. I don't like swallowing tablets every day, but you have to when you know you have a condition that you need to treat. So reducing the number of pills by combination, we should be a lot better at doing, I think, in the NHS. Someone's put in the chat, some blood pressure medications protect the heart and the kidneys. Absolutely. Thank you for sharing. You've been on them since 2009. So it's really important to be consistent, build it into your routine. Do you need to set an alarm on your phone? Do you need to put it by your toothbrush? Do you need to put it by your coffee? Like, what is it? Is it taking it at night to avoid dizziness? And there's some evidence taking it at night helps reduce side effects and also prevents things like being dizzy when you go up from sitting to standing and falls. So there's lots of things we can do. But if you don't tell us honestly what's really going on, we can't then address it. And like I said, remember that consultation is a meeting of two experts. It doesn't always have to be your doctor. We have really great pharmacists in our practices now. We have great advanced nurse practitioners. We have other team members of the team that can maybe sit and maybe even spend longer with you to work out that personalized care planning that's so crucial to compliance, adherence, and really reduction of these risks. We want to see those outcomes, which are reduction of blood pressure, reduction of cholesterol, prevention of these strokes.
Yeah, definitely. And as Dr. Oge was saying, the real key issue is understanding that with all these risks of high blood pressure, diabetes, and everything, lifestyle is the pillar, right?
Mm.
But there is a reason why medications exist, because even with all the lifestyle changes, sometimes it's insufficient. But we have, you know, as Dr. Oge was saying, we have a huge list of potential medications. So if something doesn't work for you, we can try something else, right?
Yes.
And I think that's the other thing, is that don't think, oh, it hasn't worked. Doesn't mean that we can't find some other option, that will work for you. And when you think about the long-term benefits of improving, as someone mentioned, your kidney and your heart, that protection, then you can understand that actually the fact that so many of us are hesitant, and there's so many myths, or a lot of the myths that we perpetuate in WhatsApp, on social media, around high blood pressure and so-called treatments. I often have these conversations with my patients, particularly from the African and Caribbean community. They'll tell me, oh, I went home and they came back with some medication that someone gave them, at home. And a lot of the time, we don't know what are in those medications, and in those, they're not medically tested. So it's really important that we use things that we know have evidence base. We know what
Yeah.
we're giving you. We know what the side effects are. We know what we can change it to. And that's why we need to just build that trust, as Dr. Ilozue said, the trust between two experts. So we're
Yeah.
not trying to push something. We don't have an agenda. The only agenda is so that you're well, right?
Yeah.
And how we get you well is a combination of how we work together as clinicians and as patients to have that personalized individual approach, you know?
Most definitely.
And that's what it's all about. So looking at a bit more questions, someone has asked about, do fresh foods truly exist anymore in the UK, or
Hmm.
more genetically modified fresh foods? Social determinants can be where the most obstacles are. Um,
Absolutely.
yeah,
No, totally. And I saw that. And that's the question I asked myself. It can be a real rabbit hole of what to eat, what to buy. But ultimately, whole foods, will always be better than anything processed. So, yes, you may be worried that that apple or banana is processed, but it's always going to be better than a ready meal. But I do think we need to address that's where the food industry comes in. Someone was talking on the radio the other day, and she said, actually, if I get a tin of, canned sausages or something, I can it goes further to feed my family of four than a bag of apples, and that tin is cheaper. So there is something about real access and cost of living and access to these fresh whole foods. So whole grain, whole foods, eating the rainbow, eating different colors, vegetables, your peppers, your carrots, your cabbage. It is really important, and finding ways to cook it freshly but quickly as well, because we do live busy lives. And yes, you go into the supermarket, you're like, which is GMO, which is not. But I'd always say buying the fruit and vegetable will always be better than anything else. Like I said, we're not in our villages growing our own vegetables. If we're not there, we have to make it work for where we're at the moment, while still canvassing for the food industry to make sure the food that gets to our shelves is properly grown and processed without all this genetic modification or extra pesticides and things as well. And there are ways to clean it thoroughly when you get home and cook it in a way that can minimize some of the risks from the way the food is manufactured. But whole foods and eating the rainbow will always stand us better than not.
Absolutely. And I think also we need to just extend ourselves some grace. You know, there are
Yeah,
multiple ways
true.
in for those who are struggling financially and may not be able to afford some of the more expensive, because we know the so-called organic can be
Yeah,
so much more expensive. And actually, a lot of the time, it's not necessarily as organic as you think it is. But
exactly.
actually, frozen vegetables, frozen fruits,
Very good point.
can be really, really helpful. And you know, when I used to live in Islington, there were people who would, you know, like in Finsbury Park, there were wherever you live, there can be markets where people sell fresh fruit. So I remember there was, I mean, it's a few years ago now, but he would sell like a bowl of fruits and vegetables for £1. And like there are different places where people have access to fresh fruits and vegetables in like that, not necessarily the shop. So there's markets and stuff like that that can be cheaper. I know it's not
Yeah,
always the case, but sometimes, thinking outside of the box, how can I access this in a way that is more affordable? But frozen fruits and veg can be really helpful. You can use the frozen fruits to make smoothies. You can use
yes,
frozen vegetables to make stir fries. Again, buying packs rather than things that have already been cut up sometimes is cheaper. I know obviously then you have to cut it up, which is a bit more stressful. So you have to sometimes balance the cost versus the convenience. But there's always a way, and so many different websites have ways of having healthy meals for a budget. So it's always worth a Google or a YouTube video to look at ways in which you can incorporate the rainbow diet on a budget.
absolutely. Thank you. Yeah, no, it is tough, but we have to be intentional about it and do stuff that suits our lifestyle. And
Yeah.
start small, but building those consistent habits over time is crucial and can be life saving.
So I think we're going to start rounding up the conversation now. Um, Thank you so much to everyone who's asked questions. Let me just see. Oh, somebody's just said you need to have healthcare professionals who treat patients with care and respect and listen to
Absolutely.
patients. Remember, you only have 10 minutes with the GP. So how can we have, excuse me, a healthy, balanced discussion with the healthcare person about your health concerns? I think this is a very challenging situation because
Mm,
we time is really tight with appointments, and I know that people feel rushed sometimes. What I would say is a good idea is to write down the key points that you want to discuss with the healthcare professional so that you remember to talk about them all during the appointment. Now, a lot of clinicians will say one issue per appointment, and that's understandable. But if that one issue has multiple subtexts, so you just remember the questions that you want to ask. But again, if you also have, you can request a double appointment
yeah.
if you want to discuss additional things. I don't
And
know if
like I said, yeah, no, the other thing is, like I said, the other members of the team, the GP may be the most, in demand, but we do have a wider team. Your pharmacist is such a wealth of information, and they may be able to have more time, especially about the side effect profile, and really go through what it is that your concerns are about side effects with some of the medications you're taking. So we also have great advanced nurse practitioners and other members of the team that can sit down and have more time for that personalized care. But a lot of GPs, some are interested in chronic disease management. I know we have a diabetes clinic and a clinic where we can then talk about some of these chronic conditions in a lot more detail. And those are always double appointments. So if you are concerned, writing it down, submitting an online consultation with all the points, and then the team can then book you in that double that you may need to then try to address them all. So these are some of the things to try to help to get more time. But I agree about being treated with respect. Like I said, it's a meeting of two experts. That's what I teach all my trainees. And to maintain that curiosity in your life, because you are the expert in your body, in your life, in what's possible and what's not. So let's have that mutually respectful conversation. There was something in there about beetroot and blood pressure medication. I don't know that you can't have beetroots with blood pressure medication, but again, try it, measure your blood pressure, look at the outcome, and discuss it with the person that prescribed it to you if you're concerned. But beetroots are very good for you on all accounts, from what I know. And again, part of the rainbow. So I'd encourage it. Put it in a smoothie if you don't like the taste. but it's a tip, I'd say.
Beetroots, very good for you. No, I think on that note, I think we could probably wrap up the conversation now, and say a huge thank you to Dr. Oge Ilozue, who is just so fantastic. You've answered the questions so amazingly. This has been a really robust conversation.
Great
And
conversation, yes.
I'm sure that everyone has taken something. I've certainly taken something from this conversation. So thank you so much. We'll now
Thank you.
hand
And
over.
thank you to you and for sharing as well. Amazing facilitator.
Thank you. So we'll now hand over to Laurenti.
Oh, thank you very much. Thank you. That's great. Thank you, Dr. Oge, and also for your fantastic presentation. It was fabulous, enlightening, and very informative. And also thank you to our fantastic host, Dr. Itunu, in London. It's been a fantastic session. And also like to say thank you to all of our attendees on Zoom, Facebook, and YouTube. And if you would like to access any of our Health Hour sessions, you can find them on our YouTube channel. So please do complete the evaluation link as well, which my colleague will put in the chat along with some of the information she's put in there today, because we would love to receive your feedback and your ideas. So now I'm going to share some of our upcoming events with you. So please do put them in your diary and share them with your family and friends. I'll just get the slides up. Okay. Just gonna share. There we go. There we are. Okay, here we are with the slides. Right, okay. So our next cat tip health hour session will take place again next week, same place, same time. So please do tune in to benefit from the expertise of our Black doctors. So next Saturday is the 1st of June and it will be at 11 till 12:15 p.m. And to register for the session, please email info@carn.org.uk or scan the QR code above. And please do keep an eye on our social media streams for further information regarding the topic for our next cat tip session next Saturday. And taking care of your health starts with your diet, as discussed in today's session, and also physical activity. So please do join our next Healthy Heart session, which our sessions happen every Tuesday, same time, same place. So our next session will be on Tuesday, the 28th of May, and that will be at 6:30 till 8 p.m. And the topic is navigating the weaning journey of pureed foods. So to register for the session, please email events@carn.org.uk or visit the portal.carn.org.uk Healthy Hearts. And if you're looking for ways to stay fit and to meet friendly faces, please do join our fantastic physical instructor, Orlando Grant. He does sessions on a Monday at Red's Gym in Oldham and also on Wednesdays at Moss Eye's Leisure Centre in Manchester. And the PAW Club, which is a physical activities and wellbeing club, is free, which is fantastic. So for further information, please contact PAW Club at carn.org.uk or call 07464317635 for more information. And Carn's family and advocacy sessions occur every second Wednesday of the month with the purpose to address the issues that are faced by the families and individuals of the Caribbean and African community. And our next session is on the 12th of June, and the topic is tenancy issues, rights, responsibilities and remedies. And our speaker will be Tricia, who is a advocacy and empowerment officer. And to register your interests again, please scan the QR code on the flyer or contact us on 077 100 22382 or email advocacy@carn.org.uk. And I am proud to announce the Black Healthcare Awards, which is the first to focus solely on Black healthcare professionals of the Caribbean or African diaspora. So join us in celebrating their outstanding practice and determinations. So who is your healthcare hero? Is it a doctor, a nurse, or a dentist? We want to know. So let's celebrate and highlight their incredible hard work. And to get tickets or to nominate online, please go to www.healthcareawards.carn.org.uk, and we look forward to seeing you on the 27th of July at Park Plaza, Westminster Bridge in London. And do you vote? Your votes matter. So please join us at the Shaping Black Britain's Mandate, Engage and Empowerment Black Communities in the electoral process event. And that takes place on the 28th of May, and it will be 11 a.m. till 4 p.m. at the West Indian Sports and Social Club, which is at Westwood Street in Moss Side, Manchester. And for further information, please contact Lesmond at carn.org.uk or phone 077 65 038 224. Your presence matters. Young people, parents and guardians, you are all invited to our Young People Empowerment Forum. And the topic on this forum is recognising and dealing with the signs of anxiety. And the date is the 26th of May. And it will be at 6 p.m. till 7:30 p.m. and it is an online session. So for more information, please contact Daniel at daniel@carn.org.uk or phone 0738 98 44484, and please do register your interest, and you can use the QR code to scan for that information. And also the Caribbean and African Wellbeing Hub as a launch event on the 7th of June. And the hub provides perinatal, maternal and mental health support to Black women across Greater Manchester. So do attend this launch event. It will be at 10 a.m. till 1 p.m. in the Gorton Monastery. So to register, please go to the portal at carn.org.uk/wellbeing hub. And if you've got any questions at all, please email health@carn.org.uk. So I would like to say thank you for joining us today, and we do hope to see you all next week. And a big thank you again to our amazing guest speaker, Dr. Oge, and also to our host, our fantastic host, Dr. Itunu. I will now hand you back over to the comms team. So do enjoy the rest of your day.